Well, good afternoon, everyone. And on behalf of all my fellow Atlantans here, we want to welcome you to Atlanta and to Georgia. We are going to build off of the last panel and tell you some things we're so proud of our hometown related to belonging and bridging and collective effervescing. We really hope that you have a sense of being here in Georgia, in Atlanta, and not just at the Social Connection Conference. Sorry about the weather, but at the same time, one of the things I love the most about Atlanta is its greenery. We call it a city in a forest, and we wouldn't have that greenery without the rain, so we welcome that as well. I'm Beth Brown. I'm the Managing Director for Mental Health and Wellbeing at the Arthur Blank Family Foundation, and I come into this conversation through the work I lead on mental health and well-being. We're investing in supporting flourishing well-being for young people ages 0 to 18, and we cannot imagine that flourishing without a sense of social connection and belonging. I'm also really passionate about the well-being of nonprofit leaders. It's always hard to be a nonprofit leader, and this is an especially challenging time. So I just want to thank all of you for what you're doing, because I know even though you might work in the field of social connection or mental health and well-being, that doesn't mean that you're not having challenges yourself. So I wish you as one thing from this gathering, that you leave with your cup a little fuller. And now I'm going to introduce and turn to our panelists. I think, how many of you live here in Atlanta? Do we have a lot of Atlantans in the house? Okay, some, but still I know people are here from around the country and around the world. So we're really proud of the history of Atlanta and just so many leaders from the civil rights movement and the birthplace of the civil rights movement. We're also proud of our present and our future, of which my boss and Chairman Arthur Blank definitely sees himself in the mix, a mix of that in terms of the Mercedes-Benz Stadium and owning our soccer team and our NFL team. And in the spirit of bridging, maybe some of you would just like to cross on over that NFL bridge and be Falcons fans. Right? So we've just got an amazing panel here representing public policy, representing leadership in health, and representing leadership in Atlanta's culture. Shannon Jolly is with the Atlanta Mayor's Office of Policy, Strategic Partnerships, and Initiatives, and he supports the mayor's vision of making Atlanta the best place to raise a child. I just love that as a vision and a tagline. Next to him is Bem Joiner, who's the founder of Atlanta Influences Everything. He's going to tell us about that, and by the end of your stay here, you too will be wearing the t-shirt and taking that back to your hometown. And next to me is Dr. Sonu, who's a physician at Emory and Grady Healthcare. And he, like me, we did a boomerang, returned home to our hometowns of Atlanta. And he's really thinking about what does healthcare look like if we include connection and really seeing patients as part of that formula. So we're just going to get right into it. And I'm going to start with you, Shannon. And Shannon, before I ask you the real question, your bio includes that you're a triple dog. Please tell us what that means.
Go dogs, go dogs. Do I have any dogs in the room? Okay, y'all know. Yes, so I was fortunate enough to have all of my degrees from UGA. So from undergrad all the way through my PhD. So triple dog.
Excellent. So Shannon, from your perspective in working for the mayor, what do you think we're doing right here in Atlanta when it comes to building social connection?
Yes, and I think the important thing, like obviously you think about Atlanta, we sit at this intersection of culture, you think about sport and entertainment, you think about the work that our nonprofit partners like yourselves are doing, and it creates an opportunity where we acknowledge the past. I think a great thing that the mayor's office does is we acknowledge, hey, there was a lot of policy that was not great. You think about redlining, you think about exclusionary zoning. And we see the remnants and the implications of that every day. And so it's created this structural divide. And so all of our work has been rooted in building that bridge to gap that divide. So when we go out into the communities, one thing that this mayor has done really great is been intentional with going to our neighborhood planning units. And so we meet with community members and say, hey, this is what our plans are. Tell us, is this going to work for you? Or if it doesn't, we're not going to have all the answers. We're not going to get it right. But once you tell us, we can implement that. And so as we start putting that together, we let our partners know, again, Arthur Blank Foundation, others, nonprofits, and we've woven all of our missions together to say, hey, we still want Atlanta to be a place where everyone can thrive. And so together we're centering voice and agency as we make that happen.
Thanks for that, Shannon. And now I'll turn to you, Bem. And I think a lot of us believe in doing work more upstream, and I'm aligned with the philosophy that everything is downstream from culture. So tell us a little bit from your perspective around what we're doing right when it comes to connection in the city of Atlanta and your view and role in that.
Man, thank y'all for having me. Shout out to Art Pharmacy and the Appletons, and they connected me with Morgan, and I actually connected with Phil apparently a couple years ago about this actual conversation. And my name is pronounced Bame. I have an accent mark over the E, but I rarely have it there. But yeah, I think that, and I kind of told the mayor this one time in a slick way, you know, if you're not gonna help sometimes, don't hinder. And the best thing that the city does currently, now moving forward, there's some things in the works that I love, is don't get in the way. You know, let the creatives and the culture kind of let them do what they do. I mean, Outkast just made it into the Rock and Roll Hall of Fame without policy. You know, at the time when they came out, Atlanta wasn't even a place where hip hop was, where we were respected in the game. And so there is no real music policy. This isn't Nashville. We don't have a music row. So there's no real music policy on the books. But the city never got in the way of the culture. They allowed for it to be. And now moving forward, that understanding of what got you here won't get you there. You know, so hopefully moving forward, there'll be some policy and infrastructure placed around the culture. But at best, man, versus other cities that hinder creativity, and a lot of times not intentionally, they outprice the creative. I mean, talk to San Francisco, talk to New York, and we're gaining a lot of their young talent because they've been priced out of their cities, and they're getting the word that Atlanta's the best place to raise a family and a child. So we're gaining other creators from other places. I think our mayor's, I think we voted another week. He's more than likely going into his second term. So like infrastructure around supporting and leveraging culture is something that we are currently discussing.
Great. And can you tell us just a little bit about Atlanta Influences Everything for people who may not be aware?
Oh yeah, I should have done that first. And shout out to Table 8. When I got in, they grounded me. So I gotta ground the room. You know, if you're not from here, it could seem, I don't know, abrasive or like, you know, okay, what is that? So we justify the statement by what we call 3 C's. And we're a civic-minded civic-minded creative consultancy. That's how we identify, and how we justify the statement as brand guys. Silhouette, like the silhouette of Dr. King and the civil rights movement. So that's the first C, civics. We gave the world Dr. King. You know, that's our guy. That's our hometown guy. And Atlanta proper is very small. The metro area is where I think we've cracked the 8th largest or whatever. But so the silhouette of Dr. King and civil rights is the first C. The second C, from the same small city as Dr. King is the example of Coca-Cola you saw earlier. Atlanta's, again, not that big, but we were able to give the world Dr. King and Coca-Cola. And Coca-Cola kind of represents all the Fortune 500s. We have the third largest metro chamber in the country. I think 7 or 8 institutions of higher education per square mile, which is rare. World's busiest airport. A lot of newer Fortune 500s, well, Mercedes-Benz North American headquarters, Porsche, Rivian's new East Coast headquarters, Google's East Coast headquarters, Airbnb. So we are open for business. So that second C is corporate commerce. And then the third C, Outcast is while the cast is spelled with a K, that C stands for culture. And that cultural C is creative scene and culture is fluid here. But in terms of America and in terms of grounding, this is a safe place for African American expression. And it is the home of the African American diaspora. There is no Koreatown or Chinatown or anything like that for African Americans in America. Like, we just here, you know. And at the time when we tried to do a Black Wall Street in Tulsa, if you know your history, you see how that worked out for us. So because of really what this conference is about, Atlanta is the definition of social connection and seeds of connection, because those seeds were sown with the cooperation of at the time, Black and white people coming together to build a great city. And that meant that the white business community in Atlanta wanted to work with Black politicians, and again allowed for that partnership allowed for Outkast and many other, we're in the TikTok era, so dances, like majority of the content you see in pop culture, I would like to say if we say that African Americans are the root of what becomes cultural cool in America, and if Atlanta is considered the Black Mecca, then if you trace that data back, not all of it is coming from here, but a good portion. And it's not all Atlanta born. It's a variety. It's the migration, and it's because that peach that's coming out of the state seems to be a bat symbol for, you know what, I think I can be grounded there. Let me try my luck there, and we're open for that. You know.
Beautiful, thank you. Some of you are planning on moving to Atlanta just in the past 10 minutes, I bet. So we're gonna move from TikTok and culturally cool to the doctor's office. So tell us a little bit, Dr. Sonu, from the healthcare perspective, what do you think is going right for Atlanta in terms of the intersection of healthcare and social connection?
It's a big question. First, I just want to say thank you for having me. I don't feel deserving to share the stage with you all. And I honestly have a bit of imposter syndrome up here, because I think there's some healthcare professionals out here who could probably speak to this more articulately than me, but I'm also a fan of Atlanta Influences Everything from Afar. I've got a few hoodies, so hook me up, babe. But I work 2 blocks down the street. I actually walked here from the hospital to get to this conference center. I work at a big public safety net hospital called Grady, and that's where I see adults, and then I see children at a children's hospital next door called Hugh Spalding. Grady was founded in 1890, and it opened its doors in 1892. And if you're not from Atlanta, you drive around a little bit, you'll see these billboards that say something I wouldn't be here without Grady. And when I started working at Grady almost 10 years ago, what I found fascinating that I'd never heard from the other places I trained at was patients coming up to me, and these would be our seniors, you know, people in their 90s, 80s, 70s, some people in their 30s and 40s, proudly saying, "Hey doc, I'm a Grady baby, and I'm here." And the places I trained at before, nobody came up to me with that kind of pride to say that they had been at this hospital that I was working at. So there's something about Grady that represents something in Atlanta. It's not only a safety net system that has cared for people who have been underinsured or uninsured or marginalized or underserved. It's been a place that's cared for everybody in Atlanta. And when I was 4 years old, I got my ear tubes placed by an ENT doctor at this very hospital. Many of my friends who now live in the suburbs of North Atlanta also got care at Grady or were born at Grady. So as a hospital, it's a unifying institution, and it means a lot for people who have grown up here. It's a place that it's special in many ways, but what I'll say is that it's a place that nobody has to work at Grady who works at Grady. I think one of the things that keeps me going, yes, it's a safety net system, yes, resources are thin. Yes, the hospital is on diversion all the time since another big hospital in this city closed down. It's a difficult place to be. As a matter of fact, tomorrow I go on service. So I'm thinking about all the patients that I'm going to be taking care of in the hospital who don't care about a gathering like this. They count on me to embody connection to them. But it's a place where myself and the people I rub shoulders with, not just other docs, but nurses, the front desk staff, the people who work in the cafeteria, the people who help with transportation and handle security, everybody is there purposefully. And we heard collective effervescence. I feel that all the time at a place like Grady. And so it's absolutely a place for me that represents more than just a hospital, more than a place to provide health care. It's a symbol of something that has provided a great need and service to the city and will continue to do so. It's our identity.
I'm really curious thank you. You know, assuming that, but let me know if this is not the case, that connection and belonging are not core courses in medical school. How did you come to see your work through that lens? Was it to correct something you weren't seeing, or is it the culture of Grady? I'd love to hear a little bit more about that.
No, I didn't learn it in medical school. I'm here, I would say, in some ways this topic fell in my lap. In other ways, it's maybe divine serendipity. There was a time late in my training where I was physically exhausted, but more mentally depleted. And there was a day when I was just kind of real with, why am I feeling this way? Why do I feel so disenchanted, so disillusioned with healthcare? And what I realized was, in my training as in internal medicine and pediatrics, I was really good at managing disease, but nobody was coming back to me saying they were flourishing. Nobody was coming back to me saying, thank you, I feel like my life is coming together now. And I had studied so hard. I had worked so hard in my training to be the best clinician I could be, and I was not hearing that kind of feedback. And what I realized was, at one point, that we're really good at dehumanizing the very people that we're trying to help. And what I mean by that is not that we're rude intentionally or we're disparaging on purpose, but we abstract people, the complexity of a person, their histories, their stories, their relationships, who they are in their community, and we reduce them to a problem on a page, an issue to solve. And people, we know in healthcare today that the thing that I'm talking about with my colleagues all the time is how the public's trust in us has been eroding. And it's not all because of misinformation or disinformation. I think the public is fed up, rightfully so, with the standard of care being disconnection. Now, I'm proud to say that at Grady, we're trying to be a countercurrent to that, but at the same time, Grady is susceptible to all the same market incentives, all the same financial incentive structures that that hospitals care about to keep the doors open. And so where we need to spend more time with patients, where we need to look at a person as a whole person and care for the whole person, we actually prioritize throughput and efficiency and reducing numbers instead of actually meeting people where they are.
Thank you. Shannon, I'm going to turn back to you. I mean, it's clear that we all have a lot of pride in Atlanta, and we don't have it all right. So when you look at places, either, geographies or groups where we can do better in strengthening and belonging and connection, what comes to mind to you?
So I immediately think about, so the mayor just launched our new initiative, and that is the Neighborhood Reinvestment Initiative. NRI is what we call it. And so the idea is that, and we heard, all of my colleagues on the table just mention, there's been decades and decades of underinvestment, bad policy that has disproportionately impacted certain people, primarily people who look like me in the South, the Southwest, and West side of Atlanta. And I think what's difficult with that now, for example, if we look at the data, there is a 20-year life expectancy gap for residents who live in the West side of Atlanta than those who live in Buckhead. And now without traffic, because some of y'all, this is a beast, but without traffic, that is a 10-minute drive. And you're looking at 20 years in life expectancy. So that just goes to show you what has happened in these neighborhoods. And so what I immediately think of is how do we, and it's twofold, how do we go into communities where there is no trust? Like we've told them 40 years ago, 60 years ago, we're going to protect you, and they've still been pushed out. So how do we tell them, hey, we have this big new plan, we're trying to create these new innovative financial strategies to ensure that Atlanta can still transform into this place that we all want. However, we're also working to, towards anti-displacement. And so going into rooms like that to communicate, this is our plan and we want to do it with them, it has not been that great. I will say I've been with the mayor's office now for almost 2 years, and it has changed drastically. I would say the community is taking back ownership of their neighborhoods. And I think when you think about it, they're scared. I am people, because I'm thinking, wait, now I bought in this historic neighborhood, but can I afford to stay here as we keep changing? And so I think that has been an area where we've struggled with how do you adequately communicate to community members that they're still at the center of this work, and we haven't always gotten it right, but trust us that we're going to do it with you. And again, like I said, there's a lot of work with our neighborhood planning units. We have now established what we call neighborhood partnering organizations. There are nonprofits that are standing in those key neighborhoods under NRI. So think organizations like Westside Future Fund, Grove Park Foundation, Medici Road. So these are all nonprofit organizations who are holding the mayor's office, our external stakeholders, the business leaders accountable to say, hey, you said you were going to funnel $50 million into this neighborhood to help build affordable housing, and you haven't done it yet. Or you showed us the plan, but you haven't given us movement on when that deadline is going to come. So establishing that is our way to show you that we want this to be transparency across the board. I would say looking at the business side and working with other stakeholders and partners, it's been a struggle to communicate where everyone fits in. And since then, we've done a lot of work to figure out how do we communicate to an Arthur Blank or to an Atlanta Influences Everything that, hey, tell us what your focus is. Do you do youth development? Are you looking at public safety? Okay, cool. Based off of this in NRI, we're looking at about a $60 million gap. We know everyone cannot fund that, so maybe you can help us by getting us $5 million towards this goal. And so we work together with organizations like that, and then on the hindsight of that, we work with our local nonprofits and say, hey, these people are doing this type of work. So if we can connect our local nonprofits to those larger foundations who can fund this work, everyone gets a piece of the pie, and it is a group project. So I know I said a lot there, but that's been the difficult pieces explaining how big and massive and robust these plans are to where everyone feels like they're a part of the project.
Thank you. And the picture you painted of inequity in neighborhoods close together. My guess is whatever city you're coming from, you have a version of that where sadly your zip code is more determinant of your health than your genetic code. And that's a problem that I bet many cities have.
Absolutely.
Yeah. Babe, turning to you, looking at the same question about bridge building connection we could do better at from a cultural perspective.
Man, that life expectancy thing is crazy. 'Cause I'm from Southwest Atlanta, not too far from here, but I'm a product of the Atlanta public school system, and I went to public school on the north side of town where there's a higher life expectancy. So the way I maneuver Atlanta, I don't know what really, what my life is, because it's like I live over here, but I might go to a show in Buckhead or kick it with my homeboy at a country club in Buckhead, roll a joint and smoke in Buckhead. But then I come back and live here. I don't know, maybe I got 10 years. I don't know, So, the sucky part about the name of my company, when you say you influence everything, it's a posturing statement. It's not like, keep Austin weird or Virginia is for lovers. Like we are stepping out saying, hey, look at us. And you pull back that layer and you see the data, the number one in income inequality, probably for the past 10 years or more. We have a 4% upward mobility rate here. So if you're born poor in Atlanta, 96% chance that you'll die poor. And workforce development from the business of culture is something that, we come from agriculture here. So we come from growing things. We don't come from industry per se. Like LA and New York, they're built on real executive kind of based industry. And we come from more agriculture in this region. But the business of culture is booming. And workforce development in those three C's. So first, cross-sector collaboration. It was said earlier, between those three C's, we don't build together enough. We do this thing called 404 Day in Atlanta, and it's like it kind of brings everybody together. But if those three C's, one, can communicate and break the silos from within, and then cross-culturally, cross-sector collaborate across one another, influence is worth something. If you ask influencers, they are able to exchange their influence for some sort of capital. Atlanta has a lot of social capital. So our work is based on how do you use that social capital and turn that into workforce and economic development. And we look forward to working more with the city. And the city and Grady, what you have up here, whether we actually all the way hang together all the time or not, there is a natural synergy that when we put more intentionality behind what we already have naturally, I think there's something on the other side of that.
Thank you. And so Stan, same question from the healthcare perspective. Is the bridging that needs to happen within the system itself or healthcare in community or healthcare in cross-sector? How do you frame that?
All of it. All of it. I think where I see the opportunity, though, is, I guess, to personalize it, how my own approach to healthcare has been transformed, beginning with the science on adversity. And I'm sure people in this room have heard about adverse childhood experiences and trauma-informed care. And that's what I get to teach on at the medical schools and at Grady. And it's not a fatalistic kind of thing. What it's saying is what the data has shown repeatedly, what is abundantly clear at this point, is when children experience unmitigated adversity in the form of abuse or neglect or unmitigated stress in the home due to family strife, if that is left untouched, if they are left without connecting resources to mitigate those situations, that predictably leads to not just mental and social and emotional outcomes, but it leads to the most common chronic diseases that we see every day in our adult primary care clinics. So disconnection or relational fragmentation in childhood is a major issue that is leading to all the disease burden that we're seeing today. And I for sure know that it's perpetuating, it's arranging and setting up perpetuating and worsening health disparities that don't need to exist. And so I think one of the opportunities that I've been really pressing into is educating our health professional learners, whether they're med students or nursing students, but also pharmacy, physical therapy, lab techs, anybody who will listen at Grady and at the medical school to understand that when we talk about the importance and centrality of connection, it's not a nice idea. It's not what nice people do. But if we want to have integrity to the work, if we want to actually help people and walk with them and shift trajectories from disconnection to connection, that is the way forward if we want to see a healthy society. So again, I'm not here because I'm just, it's an altruistic thing for me, but I would say if there's, it's an integrity to the work. And I'm not someone who felt like I could stay in this field, stay in this industry, just taking home a paycheck from my family, but the work felt futile. So absolutely, we need to do something on all fronts. I think there's some policy interventions, there's some structural things institutionally that we can do, but it starts with the people who are interfacing with other people and patients in the hospital where we can intervene.
Thank you. Believe it or not, they've told me we're about out of time. So we're going to end with a lightning round. I'll start here and go this way. Just to answer the question, what's one place you feel really at home in the city of Atlanta?
In the hospital. And if I may, I just wanted to share this letter I got from a patient on Friday that speaks to why connection in the hospital matters. But my answer would be Buford Highway. Food and Buford Highway, okay. This is the patient I saw a couple years ago. And at that time, with my team, we were really pushing forth this idea of connection and what it means to be trauma-informed at the bedside and taking care of the whole person. So he said, out of nowhere, "Good afternoon, Dr. Sonu. I don't know if you remember me, but I was a patient of yours at Grady Hospital back in 2023. I was a guy whose sugar level wouldn't go down, and I was there about 13 days, and we had a few talks. And I just want you to know that your words stuck with me. At that time, I was living in a hotel with no job. Today, I have a 4-bedroom house and a job with a very good company. But your words of encouragement helped me get out of a mentally dark place I was in. And for that, I'm very grateful and appreciative. Thank you for being a great doctor, and this is the best part, and a great man, my friend. My phone number is, boom. Again, thank you, and I hope all is well with you."
I wish for all of us and our loved ones that we have that kind of relationship, that we have the reason to write that kind of email a couple of years later. Okay, where do you feel most at home?
I go to a lot of concerts, so music venues, kind of. But if I were to make sure everyone here, if I say the Atlanta thing, I need to say to tout the city, it would be the Atlanta Beltline. And there's two sides, well, Atlanta was a railroad town, so it's 22 miles. It's not fully complete yet, but a railroad track that connects Atlanta's many neighborhoods, and that's why it's so dope, because you get this natural connection to people who you would normally be separated from because you're not from the same neighborhood. The Beltline brings it together, which was the vision of the creator of the Beltline, this guy Ryan Gravel. But there's a New York Times article that's currently out that is saying that the idea was great in concept, but it also displaced people. So being on the Beltline and people watching you get Atlanta from all angles. You get people that are enjoying it, like strolling. You get people exercising, and then you get people, because Atlanta's a Piedmont, it's very hilly, and they use it as which I have, as a form of flat walking transportation that you need to get from one place to another in this gridlock city. So the Beltline, it's not the most beautiful outside in the time of the conference, but if everyone could just maybe go to the Beltline, West Side Trail is probably, well, the East Side, you're in between the East Side and West Side Trail, but most definitely the Atlanta Beltline.
Thank you. And Shannon, how about you?
So I grew up on the east side of Atlanta, so think Decatur, Stone Mountain area. And so before the Beltline was the Beltline, I think of Jackson Street Bridge.
Yes, sir.
So like way back when, you would have like hundreds of people waiting to take pictures of the skyline. So that was the original like photo that went everywhere. That skyline was from Jackson Street Bridge. And so similarly to the Beltline, though, in my head, it connects all of us. And so when you think about the Atlanta that we used to be, the rich history, the civil rights movement, all the things, you think about the glamorous buckheads, you think about the tech industry that's coming, it's like the Jackson Street Bridge kind of ties all of it together. And when you think about a future Atlanta that can be this inclusive prosperity for everyone, I think of Jackson Street Bridge because you can see everyone and see where it connects people who are north, people who are south, all the things. So that makes me feel home.
And there's this photo on the Walking Dead photo, like the main, that's the Jackson Street Bridge. That's not how we look on a daily basis, but that's us though.
Well, I hope this panel has given you a little bit of sense about how we social connect here in Atlanta and some inspiration to get out there into our city when you're not in the conference. Please join me in thanking our great panel.